Hello and welcome. Today, we're diving into the incredibly challenging but also deeply hopeful world of pediatric oncology. We're going to be drawing from an expert presentation to really understand the most common childhood cancers, how they're treated, and, well, the amazing progress that is saving so many lives. So let's get right into it. I want to start right here with this number, 75 to 80%. Before we get into any of the details, I think it's so important to frame this whole conversation with the outcome. This is the overall survival rate for childhood cancer in Spain. It's just a testament to decades of research and pure dedication. It's really the most important number to keep in your head as we go through this. So, what is childhood cancer anyway? Well, it's not just one thing. This chart here breaks it down really nicely. You can see leukemias, which are blood cancers, they make up a full third of all cases. Then you've got tumors of the central nervous system, and then lymphomas. For our purposes today, we're going to focus in on the leukemias, the lymphomas, and a few of the other common solid tumors. And here's our roadmap for how we'll do that. First, a quick overview. Then we'll do a deep dive into leukemias, followed by lymphomas, and then a couple of key solid tumors. And we're going to wrap it all up by looking at the incredible treatments that make that nearly 80% survival rate a reality. All right, let's start with the big picture. Now, while childhood cancer is thankfully pretty rare, its impact is just immense. Think about this for a second. For kids between 1 and 14, after accidents, cancer is the second leading cause of death. And that fact right there shows you why understanding its scope, and especially its warning signs, is just so critical. So the key here, really, is early detection. And these aren't signs meant to make you panic, but just to be aware of. We're talking about things that are persistent and unexplained. A fever that just doesn't break, a paleness or bruising that seems to come out of nowhere, a lump that just feels wrong, or, say, bone pain that isn't from a tumble at the park. And a big one is headaches, specifically the kind that are so bad they actually wake a child up from sleep. Recognizing these things can be that first vital step. Okay, let's dive into the most common group, the leukemias. These guys account for about a third of all diagnoses, so getting a handle on them is really key. We're going to break down what's actually happening inside the body when leukemia shows up. Okay, so try to think of your bone marrow as this busy factory that's constantly producing all your blood cells. Well, in leukemia, one of the trainees, an immature blood-forming cell, goes totally rogue. It transforms and then starts making endless copies of itself. Pretty soon, these faulty cells just start crowding everything out. The factory gets so bogged down making this junk that it can't produce the healthy red cells, white cells, and platelets the body desperately needs to function. Now, the most common type of leukemia, by a long shot, is acute lymphoblastic leukemia, or ALL. It's about 80% of the cases, and usually appears in toddlers, that 2 to 5-year-old range. But just look at that last point. Back in the 1970s, the survival rate was less than 10%. A virtual death sentence. Today, it's around 90%. That is, without a doubt, one of the most incredible success stories in all of modern medicine. But AL isn't the only player here. There's also acute myeloid leukemia, AML, and they're pretty different. AL is way more common and thankfully has a better survival rate, but the treatment is a marathon. We're talking 2 to 3 years. AML, on the other hand, is rarer. The survival rates are a bit lower, and the treatment is a sprint. It's shorter, but it's way more intense. These are really two different diseases that need two completely different battle plans. All right, next up, lymphomas. So with this one, we're shifting our focus from the body's blood factory, that bone marrow, to its security network, the lymphatic system. This is the battleground for the third most common type of childhood cancer. So if leukemia is a problem inside the bone marrow factory, think of lymphoma as a problem with the security guards, the lymphocytes, that are out on patrol. The whole process starts outside the bone marrow. The cancer gets its start in places like the lymph nodes or the spleen, not in the factory itself. And there are two main families of lymphoma. In kids, non-Hodgkin lymphoma is actually the more common one. And here's the interesting paradox. It's a more aggressive disease, but it's also super sensitive to chemotherapy, which is why it has such high survival rates. Hodgkin lymphoma is more of an adolescent thing, and it often shows up as that classic painless lump in the neck or chest. Okay, now we're going to pivot from cancers of the blood and lymph systems over to solid tumors, cancers that actually form a solid mass. Now, central nervous system tumors are the most common solid ones in kids, but for right now, we're going to zoom in on two others that are really significant. Wilms tumor and neuroblastoma. This table does a great job of laying them out side by side. On one hand, you have Wilms tumor. It starts in the kidney, it's usually found in kids under 5, and it often just appears as a painless lump in the belly. The great news? The prognosis is excellent. Then you have neuroblastoma. This one starts in what's called the neural crest, basically leftover nerve tissue from when the baby was developing. It's most common in the first year of life, and its prognosis is much more variable. And that brings us to the final, and honestly, the most hopeful part of this whole discussion. How do we fight back? This is all about the smart, systematic, and incredibly innovative ways we're turning the tide against these diseases. I mean, just look at the precision here. Treating leukemia isn't just one big blast of chemo. It's a careful, multi-year campaign. First, you have induction. That's the initial shock and awe to knock the cancer into remission. Then comes consolidation, a really intense phase to hunt down any lingering cells. And finally, there's maintenance, a long-term, lower-dose therapy to make absolutely sure the cancer doesn't come back. This is the science that gets you to a 90% cure rate. And this is where the future is headed. When standard chemo doesn't cut it, we now have total game changers like CAR T therapy. Picture it like this. Doctors take a patient's own immune cells, their T cells, and they basically act like software engineers. They take them to a lab and reprogram them, giving them a new code that specifically targets that patient's cancer. Then, they infuse these supercharged cells back into the body, and it becomes a living medicine designed to hunt and destroy only the cancer cells. It sounds like science fiction, but it's real, and it's incredible. So let's just pause for a second and look at these numbers one last time. Wilms tumor, over 90%. Standard risk ALL, 90 to 95%. Localized non-Hodgkin lymphoma, 85 to 95%. This isn't just data on a chart. This represents thousands upon thousands of kids who've grown up, who've gotten to live full, healthy lives. This is the payoff for everything we've been talking about. So it makes you wonder, right? Where do you go from here when survival rates are already so high? Well, the ultimate goal is changing. It's not just about curing the cancer anymore. The new frontier is about getting that cure with less. The big challenge now is to figure out how to dial back the intensity, the toxicity of the treatments for the more favorable cases. We want to minimize those long-term side effects and just make sure these survivors have the best possible quality of life. And we'll end with this really powerful quote from the presentation that inspired this, because pediatric oncology is never, ever just about cells and drugs. It's this meeting point of cutting-edge science and a deep human conscience. It's a world filled with powerful emotions and profound reflections on life, on struggle, and on hope. Thank you so much for joining me.